Welcome back, guys. In the previous clip, we discussed the importance of graded loading and exposure in the rehab process, using the neck injury as an example. Now, let's take an elbow hyperextension injury, which might result from tapping that microsecond too late in an armbar. Since elbow extension involves resisting elbow flexion, from a structural perspective, the armbar may put pressure on various structures, including the distal biceps tendon, as well as ligaments and joint capsule of the elbow. We do need to respect the natural healing time of those tissues and make sure we're not pushing the range of motion too early. Meanwhile, we can work on the elbow flexor muscles, which resist elbow extension, provided we do this through a modified range. As pain starts to settle and there's less discomfort with full extension, we can start applying specific mobilization techniques to restore that last part of the range. This may involve some rotation, either inwards or outwards, of the forearm, or gliding it inwards and outwards based on how these techniques feel. You may try these glides as part of a symptom modification procedure to see which feels better, and then use that to retrain range. Once we're comfortable applying decent force with the elbow extended, we can incorporate high velocity movements, such as a catch and throw. From there, progress to movements involving simultaneous elbow and shoulder flexion. Then to gentle drilling with a partner, applying an armbar very slowly and tapping as soon as you feel resistance. This is important both physiologically, by engaging the elbow flexors to resist load, and psychologically, ensuring comfort and confidence in returning to that position. Remember, this isn't medical advice. Even if you have sustained exactly the same injury, make sure that you go through the rehab process with a provider that's experienced dealing with these sort of injuries and dealing with combat sports athletes. If you found this useful, like, follow and save, and in the next clip we'll talk about how we can apply the same principles to a rib injury.